Here in Harrisburg, Mrs. Clinton is seeking advice as head of a presidential task force on national health care. Today she heard from politicians and citizens on insurance reform. One woman said neither she nor her daughter can get insurance to cover their pre-existing conditions.
There might still be an incentive to eliminate from coverage the population you're concerned about, as well as Mrs. Cross's children, because they're high risk, high expensive, constant chronic costs. And what we have to do is have a system which says, no, no, you have to take everybody and you have to deal with everybody, and you can't want some security again. They don't want to worry that they're one layoff away from losing insurance.
First Lady Hillary Clinton comes to the Susquehanna Valley on a health care fact-finding mission. Good evening, I'm Kim Lemon.
And I'm Wayne Herman. The First Lady began her day at a Philadelphia hospital. Then it was on to Harrisburg for a health care conference organized by Pennsylvania U.S. Senator Harris Wofford. News 8's Susan Shapiro was with Mrs. Clinton today. She joins us live from Penn State Harrisburg with the story.
Susan?
Wayne and Kim, this Pennsylvania health care conference, which has been going on here all day long, is just about winding down. Now, health care providers, insurers, patients, and others have been talking about ways to reform health care and the way we pay for it. U.S. Senator Harris Wofford's office has been planning this conference for almost 2 months, but just 2 weeks ago they got word that First Lady Hillary Rodham Clinton would take part. Her visit here has made a lot of people very hopeful. Hillary Rodham Clinton came to Penn State Harrisburg for this state health care conference at the request of Senator Harris Wofford. She got a rousing welcome. This is Mrs. Clinton's first venture outside Washington as head of the president's task force on health care reform.
I just cannot stress how important it is that the president has placed health care reform on the very top of the national agenda. And heard
with a commanding presence, she told the crowded conference room this country cannot go on with a patchwork, broken down health care system.
And we have to recognize that there will need to be changes in our health care delivery and financing systems if we are going to control costs.
Trying to track this
Mrs. Clinton listened intently to other speakers here and jotted notes.
You're dealing with an overwhelming illness, and the family's trying to struggle, and you're trying to make normalcy, and you're trying to get your children well. It's always back there.
Bonnie Albrecht of Westchester, who was part of a small working lunchtime session with the First Lady, is happy Mrs. Clinton is at the helm on this issue. Albrecht has discovered the nightmares of health care insurance since her daughter Miranda was diagnosed with cancer.
It's good to see that the nation is finally developing this program, and they put the First Lady in charge of it. How much better could we do?
If universal health insurance...
Healthcare providers like Philip Starr of the Southeast Lancaster Health Center are also positive about Mrs. Clinton's unprecedented role.
It obviously means she has access to the most important player in the United States, and it means that there will be health care reform this year.
Mrs. Clinton is expected to make more appearances like this around the country, gathering information on health care. Her task force is expected to present a formal report in May.
Very impressed by the quality of the conversation, and it's a conversation that needs to take place all over America.
In all, Mrs. Clinton and Tipper Gore spent about 3 hours here in Harrisburg. They are now headed back to our nation's capital. Presumably, they will tell the president just what they heard here about health care and how it can be reformed. Back to you.
All right, Susan, thank you for that live report tonight from Penn State Harrisburg, and we'll have more on this.
Quite a lot lately. She wasn't specific about how much sacrifice she was talking about or how much or who would actually have to sacrifice, but I guess if you're talking about raising taxes in
Philadelphia hospital, where they talked with doctors and patients. Later, they went to Harrisburg for a state health care conference, one of several trips Mrs. Clinton plans as she heads a task force working on a plan to overhaul the nation's health care system.
It's a very devastating thing.
We cannot go on the way we have been going.
Present ideas. She heard a lot of them, too.
It was an earful of cheers that greeted Hillary Rodham Clinton. First stop, an intimate luncheon.
I think we have, unfortunately,
Hello, everybody.
Where the First Lady and Tipper Gore joined Senator Wofford and Governor Casey to talk health care reform with local residents.
What is your daughter's chronic illness?
my daughter Miranda's over here. My daughter has cancer. She was diagnosed at the age of 3. It's a day-to-day struggle financially with our insurance, even though we have insurance.
I really appreciate Mrs. Clinton. She listened to me. I know she heard me, and she was the most understanding and very nice.
I mean, people want some security again. They don't want to worry that they're one layoff away from losing insurance.
Inside the main conference hall, the First Lady addressed more than 200 doctors, nurses, business, and community leaders. The big issue, universal health care access.
So this has to be, I think, the year when we take that action to turn the right to affordable health care into a reality.
We need to have good access for all the people of Pennsylvania. This is what we're all trying to do, and this is what this meeting is all about.
We want it to be preventive, not curative. Healthcare now is geared toward curing things.
Promises of universal access to health care are what got Senator Wofford and Bill Clinton elected. The hard task now is coming up with a plan everyone can live with. The Wofford and Clinton administrations support a concept known as managed care. It's basically an HMO concept that would make patients choose between health care plans instead of having a choice among individual doctors.
I think it's a good idea. I think under the current circumstances and with the problems that we have to deal with, managed competition probably gives us the best chance of success.
There's a concern that maybe it'll be an illusion that people are going to have insurance, but they might not have what they really need, and it might just be very complex and burdensome.
Whatever the plan, Mrs. Clinton says she hopes to have it on the table by May.
I was very impressed by the quality of the conversation, and it's a conversation that needs to take place all over America.
And after putting a finger on the pulse of Pennsylvania, she says she's confident it'll be a plan that works.
We love you, Hillary! You too, Tipper!
Thank you. We love you. Allison Alexander, 27 News Tonight, Middletown.
The First Lady's husband, President Clinton, is still